Kenya. I'm going to be a nurse today. Let me wash my hands. Alright, let me get it started. Get my notes here. Alright. I'm going to be your nurse today. And I want to make sure we got the right person. Even though you're telling me you got the right name, I need to check your armband, okay? All right, so your name is Akeisha Triplett. You were born May 15, 1996.
Yes, ma'am.
Okay, oh, today is your birthday. Happy birthday.
Thank you.
Okay, we got a baby girl that was born 2 days ago. You're on your way out to be discharged, okay? So in order for us to make you, kind of help you to understand, we want to make sure you understand the orders of discharging, okay? That means you're going to be going home, and we got some things that we want to talk to you about,
Okay.
and to make sure you understand everything that's going on with you and the baby, okay? So, for starters, this is called like a postpartum delivery, and that's everything after the delivery, okay? We understand that you'll be doing some bleeding, lochia, and what it is we want you to, when you notice something different, we want you to notify us, and we're talking about, like, for instance, if you have a period or a pad, and it's more than like a lot of blood, and maybe you're feeling weak, tired, just drained or fatigued, we want you to call us or even come into the ER. Okay. Then if you're experiencing discomfort in the belly area, you may be able to use maybe a warm cloth or just lying down. Prone can help, and when I say prone, that means maybe lie on your stomach just a little bit, and maybe 10 or 15 minutes, and you can get up. Always check your pad. You check the pad every 4 hours, or every 15 minutes if you're having pain. Okay. Activity. Being that you just had a baby delivery, vaginal delivery, we want you to kind of take it easy. It's okay to get rest when baby is sleeping. Okay, so when that baby is asleep, you need to be asleep as well. Okay, I would like to talk to you about, kind of walking around. The more you walk around, the more it is for you not to have DVTs. Clots in your legs. The more you sit down and don't move around, you have clots in your legs. We don't want that to happen. Now, if you feel any kind of redness, warmth of your legs or any extremities of your body, we want you to come in and get treated in the ER or call your healthcare provider. Okay. You can also wear TED hose. This can help with the DVTs or creating the DVTs. We don't want you to get any blood clots, because blood clots can travel from your legs all the way up to here to your heart, and we don't want that. It causes another type of complication. So make sure you can just walk around, move around, and that's fine. You can also do leg exercises, flex and dorsiflex your feet, so you can get stimulation in your feet as well. Okay. No sexual activities for the first 6 weeks. We say that because you don't want to be pregnant again. Yeah, for sure. I understand that, but that can kind of make you bleed. Right. So we ask of you your first 6 weeks abstain away from sex. Okay. So I noticed that when you was having your delivery, the doctor had to do like a episiotomy, like he had to cut you a little bit. So for that care, we want you to, it's different ways you can care for it, but we always want you to kind of get maybe like a bottle. I'm gonna say like a little squeeze bottle. Fill it with warm water, squeeze down there, and blot dry. Don't wipe, but blot dry, okay? We always want you to change your pad every time you go to the bathroom and urinate or have a bowel movement. We want you to, just change it, okay? That's going to keep down infection. We don't want you to have an infection. And if you're having any kind of pain or, even drainage like purulent yellow discharge coming from that, or just heavy bleeding, we still want you to come to the ER or call your MD, okay? We're gonna always assess for the attempt of Lucia. We already talked about this, and I'm saying Lucia, on probably your third or fourth day, it should ease up.
Okay.
We're looking at probably pinkish color, maybe yellow, too clear.
Okay.
That's a sign of that you're healing well.
Okay.
So yeah. All right. You can also use a bathtub. You can sit. It's called a sitz bath. Having a sitz bath that may calm down some of your pain and your discomfort. That may make you feel good, even in your stomach area. You may just sit in the bathtub. We recommend 20 minutes. And after those 20 minutes, make sure your pad is changed clean and all that good stuff. Okay. Any signs of infection, we want to make sure that your baby, whenever we know when you have a brand new baby, a lot of people want to come and see you. We kind of want to kind of limit that because we don't know what people have.
Right.
We don't know if they have colds or COVID. We don't want a brand new baby to have COVID.
Okay.
So what we want you to do, we want you to have people, if they're coming to see you, limit the amount of people first. But if it's your mom or your dad or maybe your brother, have them wash their hands. Maybe have some sanitizer sitting at the door saying, you cannot touch my baby until you sanitize, because babies right now are prone to infection. So we want them to, be safe as well as mom to be safe, and everybody else that's coming around. We want them to, be on the lookout of wash your hands, sterilize, and maybe you can hold the baby. Right. So it's really up to you. So we just want to let you know this is what we should do. Okay. Let's see what else we can talk about. Okay, so if you having any signs of depression, what about now? Are you having any signs of depression? How do you feel?
So far, I think I'm happy.
Okay, and that's great. That's great. I'm saying, sometimes after you get out the hospital, you may have postpartum blues. They call it the baby blues. Once you think, or if you think you may have that, that's like maybe signs of depression, or just don't want to do anything, or or you can't even function. The baby's crying.
Right.
You have resources, and your resources are maybe your family can come in and kind of interact and help you out, give you a little break. It's very fine. It's normal to have. Or if you think it's so severe, we want you to go to 911, call 911, or call your physician, okay? We just don't want the baby to be in harm's way, okay? All right. When to return to the doctor for your first checkup, you have initially 6 weeks. 6 weeks to, because you have a vaginal birth, you have 6 weeks to come up to the doctor. But if you have any other, signs and symptoms of fever or just bleeding or don't feel very well, always call your doctor. Always call. If you can't get to your physician, have somebody to drive you to the ER or call 911, okay? If you have any signs of fever, fever looks like you may have a headache, you may have the chills. It's different for other people. You may have just don't feel very well. If you have a temperature or a thermometer on hand, always take your temperature. Your temperature, if you was to have a fever, should be above 100.4. And once you see that or you don't feel right, try not to, you could take an NSAID, like maybe ibuprofen or something like that. If it doesn't break the fever, always call 911 or have your mother to take you to the ER. Okay. Okay, for the baby. Okay, now it's the baby's turn. What's your baby's name?
Cassidy.
Okay, Miss Cassidy. Okay, so we're gonna talk about her for a little bit. The baby feeding. Okay, so what we doing today? Are we doing like a breastfeed?
I'll try breastfeeding.
Okay, so with your breastfeeding, that baby is should be getting 60 to 80 milliliters of kilograms of fluid a day. Okay, and then that's for your first 8 days. Then your 8 to 30 days, that baby should be getting 120 to 180 milliliters kilogram per day. Okay. The daily output for your baby is 2 to 6 voidings for the first 30 days. Okay, so that means you have to change your baby's diaper between 2 to 6 a day.
Okay.
Yeah. The minimum is 6 to 8 days per the baby who's getting breastfed. Okay. The urine should look pale, almost like a lemonade color. But if it's stronger than that, you always know, call your MD. Okay. Your formula fed babies, which is not you, so you just breastfed babies. Your baby has an umbilical cord stump.
Okay.
How we would care for that, we would care for you just use very mild soap and water, and you will always use maybe like some warm water. Okay.
Yes.
Always use your pamper, fold the pamper under so it won't hit that umbilical cord, and your umbilical cord should fall off within 10 days.
Okay.
Yeah. If you have any other, thing that's going on with the umbilical cord, if you see pus or drainage or bleeding coming from it, you always supposed to go to talk to the doctor about it. Or if you can't get to the doctor, always call 911. Okay, for safety. Let's see what we can say. Okay, we know all the time we always want to keep our babies clean, but I recommend for the first couple of days or maybe the first couple of months, we shouldn't put a baby in the bathtub. It's just really unsafe. The water should be, if you do put the baby in like just a little baby tub, just put him in the tub. Don't not above his neck or shoulder. Okay. Let's see. We wanna promote safety with our babies. Always check the water. The water should be between 100 degrees Fahrenheit. And we can check the water with your thumb or even the back of your wrist, your elbow, check it. And if it's good enough for your baby, you can kind of put the baby in that. We won't, let me see the show. Yeah, it shall provoke heat loss. Most babies can't deal with coldness, so that's why we put them in like a warm bath, and that prevents crying as well. Like I said earlier, daily baths aren't necessary, but use bath time to associate interaction with like parents, like the babies. Even though they don't communicate with us, they have a different way of communicating with us, and you can still talk to them. You can still show them that you love them by just, yeah, and they grasp onto that. They're very smart, so they grasp onto us loving them. So yeah. For safe sleep, it's a national database. We recommend that baby should be placed in a supine position. Supine meaning on the back. Okay, so that's gonna prevent SIDS, which is sudden infant death. We ask for you to keep the baby on the back or unless otherwise prescribed from your doctor. Okay, now if you feel like the baby is, not getting in that adequate sleep, or you think that It's you know, the baby, you feel like the baby needs to be turned on a certain way. Always talk to your physician or talk to the baby's physician to get a clear understanding of what is safe for the baby, okay? Alright. Now, for temperatures of the baby, if you feel like your baby is having an infection, she feels warm to the touch of the skin, or just not acting normal, we always want to ask you to bring the baby into the ER, okay? We also, assess the temp auxiliary. Most doctors would like to do a temp in the rectum. At home, since the baby is so early, we do an auxiliary temp. That's under your arm, okay? Now, like I said, if the temperature is above 100.4, we always want you to bring the baby in, because the higher the temperature, the more the patient will be more of a seizure, can get a seizure. So bring the baby in as soon as possible. Okay. And for circumcision, you don't have a boy. Right. Okay, but for circumcision care, I still got to go over, even though it's a girl, I still have to go over. Okay, for circumcision care, we're checking for bleeding. Each diaper change, check for bleeding. If so, gently apply pressure. If bleeding does not start with pressure, notify the MD. Observe urination. Keep area clean and inspect circumcision every 4 hours. Wash the area with warm water to remove urine and feces. Apply petroleum jelly for each diaper change. Do not wash with soap until circumcision is off, like 5 to 6 days. Apply diaper loosely fit to prevent pressure on the circumcision. Check for infection. Circumcision sites becomes covered with yellow exudate in 24 hours. Normal. This is normal. Do not remove it, okay? It falls off. Redness, odor, swelling indicates infection. Notify healthcare provider. Provide comfort. Circumcision is painful. Handle area gently. Provide comfort measures like skin-to-skin contact. Okay. Infection control, hand washing. We kind of talked about this earlier. This is another indicator that it's just, if people do not wash their hands, it's so easy for the baby to get an infection. So we always want to, prevent infection. We do that by washing our hands for at least 30 seconds. 30 seconds. And always have you some hand sanitizer at the entrance of the door, so when you have people come in, they know they got to wash their hands, one, and a hand rub, alcohol hand rub, okay? Hand hygiene is number one. So if we have an airway clearance, and we'll send you home with a bulge, it's like a squishy bulge, whatever, like to remove suction from the baby's mouth. Sometimes when the babies have suction in their nose or anything, it's just so hard for them to breathe. So the suction, we suction the mouth before the nose to prevent baby from inhaling pharyngeal secretions. Compose the bulb and insert the tip in one side of the mouth. Gag reflex can be stimulated, suction one nostril at a time. After each use, clean bulb syringe with warm soapy water. Rinse thoroughly. Stop suctioning when infant cries. Not sound as though it is through mucus in a bowl. Okay. Your follow-up care, whenever you leave the hospital today, you will be affiliated with a nurse. That nurse should come and see you within 72 hours. So while you at home, we'll have a nurse to come see you within 2 to 3 days, 48 to 72 hours. Okay. She should be coming from home care, or this may be a community health care nurse. Okay. So, all right. So notify the MD signs of infection occur. We already talked about this. Signs of infection is fever, hypothermia. Hypo meaning the baby's skin is cold and clammy. When you do a temperature, the temperature is below 97.
Okay.
That's very important. The baby could go into shock. Okay. Poor feeding. If that baby is not feeding, you can pause it.